Welcome back. Pets are a lot like family members. In fact, they are family members. That's why they're so important to get their medical attention. Dr. Joe Landers joining us as he does every Thursday to answer your pet questions. The number 460-KJRH. Good morning, Dr. Joe. How are you?
Good morning. Just fine, thank you.
You got a little buddy here.
This is Pee-wee. This is Pee-wee. Pee-wee is, we were talking about this. He kind of looks like a West Highland, but he's a little taller, so I'm going to call him sort of a Schnauzer poodle. He's a nice little dog. His hair will get a lot longer. I was telling everybody he was kind of bald 2 weeks ago because he had a lot of fleas on him because it's flea season. But he is a nice little dog, and part of his name because he's a very submissive little guy. So sometimes he does pee-wee a little bit. So.
We had
but
a
actually, he's coming
like
right
that.
Absolutely. So he's a good little dog. He's over at Heritage, or he can be seen at animalaid.org on the net.
He's been really sweet and just kind of quiet and hanging out with us here. We're going to get to the callers real quick. Faye in Bartlesville is our first caller. Faye, you there?
Yes, I am.
What do you got for us?
I have a little mixed breed dog, about 4 years old, and often when she eats, she throws up. And she doesn't throw up right away. It's, later in the night, but I don't know, and I've tried all kinds of dog food, and I don't know if there's a sensitive kind, if I should give her some medicine before.
Well, sometimes if it's delayed like that, it may not be the food itself. I mean, it certainly could be. There's a lot of different deals. One thing to always talk about is having on a monthly heartworm prevention, because that'll usually kill all the internal worms too. Sometimes they can have some delayed emptying problems, and that's something to kind of discuss with your veterinarian. Sometimes you also talk to them about antacid. Some of these guys, if it does lay in there too long, they'll build up some acid and then kind of throw it up. And there can be some other deals, but that's something you probably want to have checked out. You do definitely want to check for worms. There's one tapeworms that the heartworm stuff doesn't get, so that may be something for them to check the stools for sure. So, hi, kiddo.
Darla is our next caller. She's from Tulsa. Darla, you with us?
Yes.
Hi.
What's your question?
Okay. I have I guess she's about 9 months to a year Shih Tzu that I rescued. And I was wondering, she's matted up really bad on the bottom of her underbelly, and it goes all the way to her tail.
Yes.
Is there any easy applications that I can put on her until I can get her into the vet that'll make her more comfortable?
Well, it depends on why she's matting up, if it's due to allergies or fleas or something. And a lot of times I'll tell people, or if she's just kind of one of those dogs that doesn't groom herself as well and she gets matted. This guy had that problem too because he had a bunch of fleas on him and he just was itching. And frankly, what we did, and you probably want to go to a groomer and just have it shaved off and start again, because most of the time that hair, as the mats come out, it hurts them more to kind of pull out all the mats usually than it's worth it. And usually with a good groomer, they can just shave that off and start again. The other deal is kind of the underlying problem. If we're itching a lot or something, you can certainly try some Benadryl, one of those a couple times a day. But the other deal is to see why we're doing that, because at 9 months old, that's pretty young. Some of them are just, they're just kind of, I don't want to say dirty, but I've had dogs like that just they get in the mud and they run around and they're not very, they don't take care of themselves and clean their own coat. So you just have to kind of do it
Help
for
them out a
them.
little bit.
Yeah, absolutely. So, but a good groom sounds like it might be in order. So.
Another caller from Tulsa.
Yes.
Christy's in the chute there.
Hi there.
Hi.
I have a 5-year-old golden retriever, and she tends to get hot spots around this time of year, and I was wondering if there was anything we could give her to almost prevent the hot spots from coming on.
Most of the time, hot spots are from an itching from something, usually an allergy or fleas. Most of the time, you can use some Benadryl. A lot of times, by the time what I call self-mutilate, and those hot spots are caused by themselves, usually there's some infection there too. But most of the time, what you want to do with those is figure out what's causing them in the first place. But definitely give some Benadryl, 1 milligram per pound. So probably if she's about 75, you give 3 of them a couple times a day. And definitely clean them really good. Try to dry them out with a little alcohol. It might sting a little, and definitely put some ointment on them, and that will help quite a bit too. Some Neurosporin or Cordate or something like that. What do you think?
All right, Dr. Joe, we
thank you very
appreciate your
much.
expertise and stopping by again. If you're interested in adopting Pee-wee, call Animal Aid 744-8280 or log on to animalaid.org.